Good morning, everyone. This is Trikla from Global Support Organization. Just a few days back, I posted a cause about a special child. Um, he needed to get his eye surgery done. Basically, we got his eye surgery 5 months back for one of his eye. And after the operation, we were told that the boy has to be going to the hospital again in 6 months' time. And meanwhile, I got a news from the parents saying that the boy is in severe pain and he's not been eating, and the second eye is actually giving him pain. So I asked them to get it checked at the hospital, and they said that the second eye is having a problem and they have to remove the eye and clear the infection. And they have given three different kind of um, estimations for the operation. The first operation, they said that it is very nominal, but the first and the second operation, they did not give any guarantee that the infection would not reoccur. And they said the third estimation that they gave, which is around 90,000 plus, um, along with removal of the eye and for placing an artificial eye kind of thing, for 90,350. And they said that kind of surgery will actually help the boy, and the artificial eye is kind of from basically they said it is imported, and it is going to help the boy and he's not going to have the eye infection later on. With all due respect of to the parents definitely would like to do the best, and we are also here to help the special child and their parents to have a less distress because of the situation they're in. They almost spend around 10 lakh rupees on the eyes of the special kid. The boy is also having problem with his brain. So the parents are very, very afraid to get the operation done from any of the eye hospitals, even if they're in top ranking in India. We suggested them to have a second opinion from Reddy Garu Hospital and also Sankaraya Hospital because we got them as second best hospitals in Andhra Pradesh from the health ministry. We also spoke to the health ministry regarding this possibility of the eye surgery, um, and to check if the Arogyasri can actually cover this. Well, the partly the hospital, which is Reddy Garu Hospital, they said they can cover this kind of an operation under Arogyasri. Um, and reason being, this special boy is having pain and they would like to consider it to be done immediately. They said that we will do it under Arogyasri, and if there is any problem later on, they will also look into that. That's what they promised, and we got back to the parents saying that Reddy Garu Hospital actually offered a free treatment, not free treatment, but Arogyasri treatment. But the parents are in such a distress that since the boy is being born, they've been going to LV Prasad Hospital, and all these years they have so much of trust, and um, they think it is an ongoing thing, and they think only LV Prasad Hospital in Andhra Pradesh can look after the situation of the boy because they know A to Z of the boy's condition. Now, after speaking to the health ministry, uh, we were told that this kind of operation should be able to be covered under Arogyasri. However, the hospital is denying that this treatment cannot be done under Arogyasri because Arogyasri has a very, very less amount which can be allocated, and this treatment what the boy will be going through is will not be covered under Arogyasri. So after all the battle that we had between the ministry and LV Prasad Hospital, we came to a situation that uh, the boy is in distress at the moment, and we cannot wait for this problem to be solved. We can't wait for the Arigishri situation to be solved because it will need time to be fixed. Whether we don't know if, and reason being of Christmas holidays and stuff in between as well. I just got this call before 4 days, and in these 4 days, I had to go backwards and forwards to the parents, to the other hospitals for second opinion, to the health ministry, to LV Prasad Hospital and stuff, but there is no solution. So what we decided is the boy is not been having food for few days because he's in pain and distress, and the parents are going through a lot of mental pain because of the condition of the boy, and they are not able to make a decision of going to another hospital for another treatment, and they're not able to even face LV Prasad Hospital to fight the battle of getting it done through Arogyasri, because they think if they actually go through a fight with the hospital, they're not going to get a proper treatment for the boy, and they don't want to spoil the relationship between the hospital and the parents, because the child safety uh, could be a concern. So at this point of time, we decided that we will ask the hospital to give it in writing that whatever treatment that they are going to do is not going to be covered under Arogyasri, and we will pay from the funds which are being raised uh, from the donors of Global Support Organization. Uh, Please understand, we tried every single possibility to get it done through Arogyasri, and we are also trying to get a letter um, from the hospital saying that the whatever the treatment the boys will be getting is not covered under Arogyasri. But if the hospital denies to give the letter, hands up, I cannot do anything more. I can only uh, request donors, please do consider this as a special consideration and be with the boy, because the boy is in pain and fighting over Arogyasri and the um, government payments for the operation might not be possible at this point of time, because it is a very short notice, and we can't put through this cause at this point of time on hold because the boy is suffering. So hope you all understand the situation that I am in right now, and hope you'll all support the decision that I have taken, that we will support the boy, because the boy and the parents are in distress, and I feel ashamed to have a self health system in our country that there is no proper yeah, link between the government and the hospitals, where they say if the treatment is being set by the government, that Arogyasri has to be given at any cost. There is no system that actually um, reflects that. There is no medium where they talk to each other and say this particular treatment has to be done under Arogyasri, or this is confirmed that the payment will be done. Because of this, there's so many kids, and LV Prasad Hospital being an NGO, it is actually making me feel so bad that an NGO is not considering to do a free operation for a special child, in need. And they are charging the parents. So far they have charged a lot, and still they are on the same medium of charging higher and higher. And even the way they are actually putting it across to the parents, making them feel like they have to get only the treatment at the most highest price, because only then the safety is of the child is uh, secured. So by telling this to the parents, it's actually making their life more difficult. And they're saying they're spending a lot of money on the special child, taking him to the hospital every now and then. So the private hospitals, the hospitals in India um, are really, really heartless. That's all I can say. And I'm leaving this message with a lot of pain, and I feel ashamed that we are not having a proper healthcare system in India right now, especially when it comes to the most deserved people, like special children, and every poor person, for instance, whoever is having a health difficulty, or anybody, even if they're from middle class family or a lower middle class family, they are having a lot of problem going through this health battle with the hospitals in India. Government hospitals are not to that level for doing the treatments, and the private hospitals, even though if they have Arogyasri, are not considering to take the patients on board under Arogyasri, because they think the government is not making payments on time, or they're unsure if the government is going to pay or not. So this is a real pain, and I can only feel sorry for everyone who is struggling with these kind of problems in the hospitals of India. And I, every trust or every NGO which is open for a good cause actually is supposed to do good causes, instead of, in the name of trust, they're actually asking a lot of donations, uh, for getting a child admission in a school in a trust. They actually are asking for lakhs of rupees. Why, if it is in trust, why do you need a lakh rupee as a donation for getting an LKG kid into your school? Why? You are Education should be not for profit. The medical system should be not for profit. I don't know, this is getting so commercial, and I feel sick to see the system of India, and everywhere for that instance. Thank you all. And if you have any queries or if you have any feedback regarding this, please do contact me on my WhatsApp. It's 0044 791 9365 Thank you so much. Hope the boy recovers soon. God bless him. Jai Hind.
మా ఆరోగ్యమిత్రేనా కన్ను ఆపరేషన్కి లేదా ఆరోగ్యశ్రీలో కన్ను